In this lecture, I'm going to use the agricultural environment to review the radiography of the toxic chemical and inhalational injuries to the lung, review anthrax, a biological weapon, and other zoonoses seen in the agricultural environment, and finally review the recent outbreak of SARS. Nebraska is a rural state with a farm economy. It's a leader in both crop and livestock production. It takes 30 inches of rainfall to produce corn and other grain crops. The natural 30-inch rainfall line equally divides the state between the east, which is primarily crop production, and the west, which is livestock production. I will use this classification to divide this lecture into disorders primarily related to crop production and those primarily related to livestock production. Nebraska, along with 5 other states, has the distinction of having more cattle than people. Although only 2% of the U.S. population is involved in agricultural work, it is more dangerous than mining or construction, industries that we normally assume are dangerous. An estimated 6% of farmers work with a disability. COPD mortality is increased in agricultural workers, which is particularly notable in view of the lower prevalence of cigarette smoking among farmers than in the general population. A diverse group of disorders make up the grain production disorders, from the common to uncommon. Chronic bronchitis and asthma are not unique to farmers, but the number afflicted with these conditions far exceeds that seen in the general population. Respiratory complaints are thus common. Many of the respiratory disorders are due to exposure to grain dust. Grain dust arises from harvesting, transport, and handling of large amounts of dried grain. The dust is mostly composed of organic material. Inorganic material is of little concern. As the most common substance in the Earth's crust, it is natural to assume that farmers would be exposed to silica. However, silica is not found in the U.S. grain production regions. However, there are areas in the world where silica in the soil is a problem. Not surprisingly, those with either grain dust asthma or bronchitis have normal radiographs, or at most, mild bronchial wall thickening. The key is differentiating bronchitis and asthma from more uncommon disorders. As we'll see later, normal radiographs are common in those with farmer's lung. HRCT is useful as a more sensitive exam for parenchymal changes. The largest dust producers are grain elevators. Little known is that grain elevators are the 3rd largest particulate polluter in the U.S. The dust in elevators can be quite dense, so thick that you can't see the man working right next to you. Elevators range from the small rural elevator to the massive urban elevators holding millions of bushels of grain. This particular elevator has special meaning for me as it was my dad's elevator, a place where I spent much of my youth. And this is my dad at his retirement after a lifetime of working in the elevator business. Unfortunately, my father would pass away only a few years later from respiratory failure related to his long years of dust exposure. Elevators can be dangerous. Grain dust, when ignited in a closed space, is explosive. Notice the corn strewn over the ground. Here we are in a dusty environment, the backdrop for our next 2 disorders. Symptoms included shortness of breath and fever a few hours after working with hay. Mild central interstitial thickening cleared within 24 hours. The differential for this scenario is either organic dust toxicity syndrome or farmer's lung. This farmer had the exact same story and had diffuse central ground glass opacities with nearly the same radiographic appearance. Clinically, farmer's lung and organic dust toxicity syndrome look the same. However, the insult differs. Farmer's lung is an allergic reaction, whereas ODTS is a non-allergic reaction to inhaled endotoxins. While we've just seen that the radiographic appearances can be the same, the radiograph in ODTS is usually normal. ODTS clears completely and does not lead to chronic disease, whereas a small number of individuals with farmer's lung go on to chronic disease. One clinical method that is useful in separating the two disorders comes from the history, and that is, how are the other workers? Farmer's lung requires that the individual be allergic to the antigen. With farmer's lung, other workers in the same environment will usually be normal. In contrast, all those inhaling endotoxins, including any other workers, will also be ill. In contrast to ODTS, farmer's lung may lead to chronic end-stage disease. Most of those with chronic disease do not give a history of acute disease. Symptoms are often insidious, with gradual onset of shortness of breath or dyspnea. Fibrosis generally involves the mid to upper lung zones and spares the costophrenic angles. The main differential for farmer's lung is IPF. One helpful distinction is involvement of the subpleural costophrenic lung. IPF is usually most severe in the costophrenic angles, whereas this area of lung is usually less involved in chronic farmer's lung. Here is a Goff section, left lung of chronic farmer's lung. Note that the fibrosis is most marked in the dorsal aspect of the upper lobe. In contrast to sarcoid, the granulomas in farmer's lungs are usually looser and not as well organized. Acute farmer's lung is one of those diseases where the chest X-ray is often normal. Even the HRCT may be normal in a substantial number. In this example, the chest X-ray is normal, but the HRCT is grossly abnormal with diffuse centrilobular micronodules. A useful technique in hypersensitivity pneumonitis is expiratory scanning. Because the granulomas are often centered on small airways, expiratory scanning will demonstrate air trapping. The combination of centri-acinar micronodules and air trapping is characteristic of hypersensitivity pneumonitis. Numerous chemicals are used on the farm to increase crop yields. Nearly all can cause respiratory problems. One misconception is that these compounds need to be inhaled to cause respiratory problems. The usual mode of exposure is absorption through the skin when mixing or applying the chemicals. One of the most hazardous insecticides is the organophosphate compounds. Common trade names are diazinon, parathion, malathion. These compounds inhibit acetylcholinesterase at postsynaptic membranes. In high concentrations, they may cause respiratory paralysis. Other effects are related to their mode of action, including increased airway secretions and bronchospasm. Paralysis predisposes to aspiration, and toxic doses may produce non-cardiac pulmonary edema. Organophosphate insecticides are extremely poisonous at high concentrations. This story concerns the death of 250 head of cattle from poisoning. Unfortunately, the organophosphate compounds are related chemically to nerve gas. In fact, it is relatively simple to switch the formula from agricultural pesticides to nerve gas. This forms the basis of the underlying debate about this factory in Iraq. Paraquat is a 100-year-old herbicide widely used to control broadleaf weeds and grasses. As little as 1 teaspoonful can be fatal. The lungs selectively accumulate paraquat where it causes cell wall damage. One of the characteristic features of paraquat is the rapid development of pulmonary fibrosis and end-stage lung. This is the typical sequence for paraquat toxicity. After initial exposure, mild diffuse ground glass opacities developed in the lower lobes. By day 9, the lung evolved into a fine reticular pattern, and by day 29, coarse honeycombing and cystic destruction. Rapid evolution to end-stage lung is typical of paraquat toxicity. Paraquat also has characteristic CT features. In contrast to the subpleural involvement of IPF, paraquat results in islands of central fibrosis. Fertilizer can refer to a variety of substances, but the main ingredient is nitrogen. Crops such as corn use a large amount of nitrogen which needs to be replenished before planting the next year's crop. The most common form of nitrogen is anhydrous ammonia, a gas. When inhaled, ammonia combines with water to produce alkali, which can damage the lung. 1/3 of emergency department visits caused by agricultural chemical exposure in a 21-county area in Nebraska in 1985 were due to anhydrous ammonia exposure. Anhydrous ammonia arrives by truck or rail and is transferred multiple times to long-term storage, into tanks which are taken to the farm, and into an applicator before being knifed into the ground. Exposure occurs due to faulty valves or fittings. In this example, a car derailment has ruptured a large anhydrous ammonia tank. Anhydrous ammonia is heavier than air and thus does not dissipate easily. The town had to be evacuated. Cleanup is accomplished with cat litter, which when sprayed onto the cloud absorbs the gas. This is end-stage anhydrous ammonia lung. 19 years previously, this individual was exposed to an anhydrous ammonia cloud. The end result was diffuse bronchiectasis. In addition, there was mosaic perfusion pattern due to bronchiolitis obliterans. Bronchiolitis obliterans is a common end-stage result from numerous toxic fumes and is not specific to anhydrous ammonia. Here is another common method of exposure. Anhydrous ammonia is a key element in the manufacture of methamphetamine. As such, criminals may be exposed when tapping into anhydrous ammonia tanks. One of my jobs at the elevator was that of a flagman. In crop dusting, the idea is to cover every row in the field with the chemical, while at the same time not going over the same row twice and lose profit. The flagman acted as a target, which the pilot used to line up his run. The flagman would note the rows covered and move down the field accordingly and get a good dousing with each pass. While it might not seem like difficult work, to protect yourself one had to wear rubberized clothing and wear a respirator. Usually the work is done in August, which in Nebraska is nearly always 100 degrees heat and high humidity. While chemical exposures might not seem important to those of us who live in urban areas, the same chemicals used in the farm are also dumped on residential lawns. Again, it is important to realize that exposure comes not from inhalation, but direct contact with the chemicals which are absorbed through the skin. Lastly, let's discuss silo fillers disease. Silos are majestic structures. They are used to produce feed during the winter months. Green-leaved crops, such as corn stalks, are chopped and blown into a silo. A fermentation process then takes place, which enriches and preserves the material and is used as a feedstock during the winter months when the pasture lands are covered with snow. However, during the fermentation process, the residual oxygen in the silo combines with nitrous acid to produce nitric oxide. This undergoes a second oxygenation step to produce nitrogen dioxide. Nitrogen dioxide is a yellowish-brown gas that has a pungent odor similar to chlorine. Like anhydrous ammonia, nitrogen dioxide is heavier than air and settles on top of the pile. Farmers are exposed when they enter the silo to level off the top of the pile. While the odor and color should be a warning signal, a lot of things don't smell good on a farm and are usually ignored. In this lab example, the flask has been filled with nitrogen monoxide. Just as soon as the cap is removed, oxygen combines with the gas to produce nitrogen dioxide. Within a few hours of entering a freshly filled silo, this farmer became acutely short of breath. The consolidation cleared within 1 week. However, approximately 1 month later, he again developed respiratory symptoms. Focal, ill-defined nodular opacities developed in the same lung that was diffusely consolidated. This sequence demonstrates the natural history of acute non-cardiac edema, resolution, and then development of bronchiolitis obliterans, organizing pneumonia. Silo fillers disease can be seen in other situations. For example, in the famous Cleveland Clinic fire, Nearly half of the patients, doctors, and employees died from nitrogen dioxide exposure. Nitrogen dioxide was a byproduct of burning films, which used nitrocellulose as the base of the film emulsion. Today, numerous cases of Sialophilers disease have occurred in ice rinks from malfunctioning Zamboni machines. Now let's turn our attention to the second part of the agricultural disorders, which are those primarily seen in livestock production. Again, just like the crop producers, many of these individuals suffer from respiratory disease. We are going to focus on those disorders unique to livestock work, toxic manure exposure, and the zoonoses. This idyllic view is how we'd like to think our livestock is raised. However, the reality is far different. Most livestock today is raised from birth to death under one roof. These confinement houses are more economical than traditional methods. How economical? In 1992, there were over 30,000 hog producers in Iowa. In 2002, there were less than 8,000. The others forced out of business by the large operators. Murphy Hill Farms of North Carolina is the biggest, with millions of hogs in confinement houses. Waste disposal is the biggest problem. Each of the above hogs produces 15 pounds of excrement a day. This waste falls through the slatted floor into a manure pit below. With 20,000 hogs under one roof, it's a large pit. The manure ferments in the pit and produces methane, which is explosive, ammonia, carbon dioxide, and worst of all, hydrogen sulfide. At high concentrations, hydrogen sulfide is an anesthetic with deadly consequences. Descending into the pit is hazardous. Typically, the victim is overwhelmed and quickly becomes anesthetized and falls into the pit, either to die from asphyxiation or aspiration. The whole sequence is known as dung lung. There is nothing specific about the radiographic appearance, which reflects aspiration, pneumonia, and possibly chemical injury. What an appropriate name for the senior author of this paper. Unfortunately, these stories are even more tragic. Not only does one victim fall prey, but the other men in the family usually descend into the pit to rescue the victim only to be overcome. In this news story, all of the adult men died in a manure pit, leaving only the small children to do the farm work. The zoonoses used to be relegated to a 1-hour medical school lecture and were rarely encountered in medical practice. However, with mad cow disease and later anthrax, these diseases have received important publicity and attention from the medical community. Finally, let's finish with the zoonoses, or those infections which are passed from animal to man. From this short list, you can see that these are indeed rare and unusual infections. Here we have a farmer who presents with a workup for fever of unknown origin. He had moderately extensive pleural thickening in the left hemithorax. The blow-up insert is a calcification in the left upper quadrant. Do you know the diagnosis? His abdominal radiograph showed multiple calcifications in the liver and spleen. The spleen is enlarged. Note the characteristics of the calcifications. A large bull's eye surrounded by a thin lucent rim in a thin-rimmed calcific shell. These calcifications are pathognomonic for brucellosis. There are 3 types of brucella: abortus in cattle, mellitus in goats, and suis in pigs. The only one that calcifies is suis. It is rare in radiology to make a specific bacteriologic diagnosis, but this is one exception. This individual worked in an abattoir for 20 years. He now has chronic cough and sputum production. Cultures grew out Pasteurella multocida. It's unknown which came first, the infection or the bronchiectasis, but most evidence suggests that chronic colonization of the airways with Pasteurella results in bronchiectasis. While histoplasmosis is not a zoonosis, it is related to bird roosts, such as poultry. Birds don't harbor the organism. Rather, the organism grows in soil enriched by bird excreta, an environment often found on the farm. I'd like to review this seminal study of histoplasmosis. This was the first study to document the nature of histoplasmosis in the environment. The story concerns a farm family that decided to put an unused silo back into business. The silo had become a starling roost and needed to be cleaned up. In doing the work, an outbreak of histo occurred, which we will review shortly. One of the interesting features is that the state epidemiologists were able to culture histo from the soil each year for the next 15 years, demonstrating that once established, a point source will serve as a reservoir for infection for many years. The father and 2 sons did the work. All became ill. Their radiographs were grossly abnormal, and one had adenopathy. The other family members were also investigated. 3 were working outside but did not participate in cleaning the silo. Although they were asymptomatic, their radiographs were abnormal but to a lesser degree than those that cleaned the silo. Each had a combination of adenopathy and lung disease. 2 worked inside and were not infected, and their skin tests remained normal. An important point is that asymptomatic infections are common. Each year we see 1 to 2 patients from the cancer center with new adenopathy. Assuming that it is recurrence, they are investigated only to find histoplasmosis. A second important point is not to trust your son-in-law. Why wasn't he doing the work too? Inhalational anthrax has not been seen in the U.S. since the 1970s. Before the terrorist attack in 2001, inhalational anthrax was a textbook curiosity. An excellent review of this disease can be found at this website from the AFIP. The attack was composed of 6 letters directed at prominent politicians and news outlets. The attack resulted in 11 cases of inhalational anthrax and 5 deaths. 2 deaths. The hospital stockroom worker and the Connecticut widow had no known direct contact with the anthrax letters. Anthrax spores were identified in 9 states, primarily related to mail destinations of the letters. However, spores were eventually found in Indiana and Missouri, far distant from the primary targets. The clue to the diagnosis of anthrax is the presence of adenopathy. Anthrax produces a hemorrhagic mediastinitis. Note that the nodes are of relatively high density due to the presence of acute blood. These images are courtesy of anthrax.radpath.org. The newest and scariest epidemic is SARS. SARS first came to attention in November in Zhejiang Province, China. With worldwide travel, it quickly spread to over 29 countries. This is a deadly virus with a fatality rate of 10%. The pathogen was relatively quickly identified as a new coronavirus, which had mutated to become a human pathogen. Civets are thought to be the animal reservoir. These are copies of radiographs from the Prince of Wales Hospital, Hong Kong, one of the centers of the SARS epidemic. The radiographic manifestations are nonspecific, with either focal or diffuse disease. In those sick enough to be hospitalized, the chest radiographs will be abnormal. CT is more sensitive in detecting disease and is useful to examine those with minimal symptoms or those who have been exposed to the SARS virus. We've reviewed many diseases related to agricultural disorders. The radiographic appearances usually are not specific. The best clue is the history, and I've tried to emphasize the different types of farm work and how farmers get into trouble. Farm work is seasonal. One important clue is when did the injury occur. Some disorders, such as silo filler's disease, are only seen in the fall after the silo is filled. Getting ill after working in the silo in the spring is not silo filler's disease, but either organic dust toxicity syndrome or farmer's lung. While I've emphasized diseases that occur on the farm, all of these disorders have their counterparts in urban environments. Agricultural workers live far from major medical centers. They, however, are worthy of our attention. Thanks very much for listening.